Have you ever had that unbearable itch down there that feels like sore, very uncomfortable, almost like your vagina is on fire? And as if that's not enough, then you notice a thick white discharge on your underwear. Scary, right? But what could really be happening? That's exactly what we're going to be talking about today. I am not Sandra, and on this channel, we'll talk about understanding your body, your health, and your fertility. In today's video, we're going to be talking about vaginal thrush, also called vaginal yeast infection or candidiasis. Oftentimes, I've seen when ladies are told they've got thrush or vaginal yeast infection, and the first thing you hear them say is, "But I'm clean, I take care of myself," or "I've not had sex in a while, why would I be having yeast infection?" Now, one thing I want you to know is that having a yeast infection is not because you're dirty or unhygienic. Neither is it because of your sexual activities. That's just a very common myth. And the truth is, yeast infection is a medical condition. It's something that can happen to almost any woman. So it's nothing to be ashamed of. It just requires the right treatment and it's off. So we're going to be talking about what vaginal yeast infection actually is, the signs and symptoms of vaginal yeast infection so you can recognize it when you have it, the common causes of vaginal yeast infection, how to treat vaginal yeast infection, and most importantly, how to prevent it from coming back. Vaginal yeast infection, also known as vaginal thrush or candidiasis, is a fungal infection which is caused by the overgrowth of a yeast called Candida albicans. Now, here is one important part I need you to take note of. Candida is not always a bad thing. In fact, a small amount of it lives in the vagina, because sometimes when you go for your test and get your result, you would usually see Candida. As long as you're not having any symptoms, it's nothing to worry about. That's because your healthy vaginal bacteria, that's the good bacteria that lives in your vagina, helps to keep it in check and maintain a natural pH balance. But when that balance is disrupted, it will automatically make the yeast multiply and cause infection. That is when you now start noticing all the symptoms I'm going to be talking about shortly. So please, you don't need to feel embarrassed if you've had thrush, because studies have shown that about 3 out of 4 women will experience at least one episode of yeast infection in their lifetime, and almost half of them will have another episode. So you see, it's very common. It's not because you're dirty or has anything to do with your sexual activity. Now let's talk about the signs and symptoms of vaginal yeast infection. The first one I'll be talking about is itching. Itching is one of the most common symptoms of vaginal yeast infection, and it usually happens around the vulva. That's the outer part of the vagina, which is the lips of the vagina, the labia majora and the labia minora. And sometimes it can even spread to the area between the vagina and the anus, called the perineum. Now, not every woman will experience itching, but when it comes, it can be very intense. In fact, it can get so uncomfortable that when you're in public, you find yourself rubbing and pressing against your underwear just to get some relief. Because of course, you wouldn't want people to see you scratching, right? So that's just how frustrating it can be. If you've ever noticed this kind of itching before, please let us know in the comment, just so you know you are not alone. Another common sign of vaginal yeast infection is the discharge. Thrush has a very typical look, and the best way I'll describe it is looking like a cottage cheese. And another common example is when you have your yogurt in the fridge and you bring it out, you tend to see those lump-like stuff inside it. And when you rub it with your fingers, that's just how vaginal yeast infection discharge can be. Thick, white, and clumpy. And some women don't get any discharge at all, but for most women, that's usually what you see. So unlike other infections, thrush usually doesn't have a strong smell. But even if there is a smell, it's going to be faint and not offensive. By the way, I have a video on my channel where I explain vaginal discharge colors in details. Make sure you check out that video after this one. Now, the third one we're going to be looking at is soreness and irritation. Thrush can also make the vagina and vulva red, sore, or even a bit swollen, and sometimes you'll notice cracks on the skin of the vulva. And this is when you now start having that burning sensation when peeing, especially when urine touches that crack. And you also notice that sex has become painful because of the irritation. Now, the important thing I want you to note here is that you can have thrush, you can have vaginal yeast infection even if you've never had sex before. Vaginal yeast infection is not a sexually transmitted infection. So let's talk about the common reasons why you might have vaginal yeast infection. One of the reasons you get vaginal yeast infection is if there is a change in the vaginal pH. So when there's a change in the vaginal pH, maybe from using douches, vaginal deodorant, feminine hygiene wipes, antiseptic, or vaginal washes, this product can disrupt the natural pH balance in the vagina and give yeast the chance to grow. That is basically what yeast wants. Another thing is antibiotics. Antibiotics don't just kill the bad bacteria, they also kill the good bacteria that protect your vagina. And once those good bacteria are reduced, yeast will not have the chance to multiply and cause infection. I also have a detailed video on why you keep having recurrent vaginal infection even after treating over and over again. Make sure you watch that video. And if you're finding this video helpful, please like, share the video, and subscribe so other women out there will get to see the video and learn from it. The third one is uncontrolled diabetes. High blood sugar makes it easier for yeast to grow. So women with poorly controlled diabetes are more likely to get thrush even over and over again. Now let's talk about the treatment of vaginal yeast infection. The type of treatment would usually depend on how severe your symptoms are, because sometimes yeast infections can go on their own without treatment. But if your symptoms are mild, you can easily get antifungal medicines from the pharmacy or chemist. Now, here are the most common options. We have the antifungal cream called clotrimazole, and it has two types. One is applied around the vulva, the outer and inner lips of the vagina, and around the perineum, mostly 2 to 3 times daily for 7 days. And once you start using the cream, you might start to notice tingling or burning sensation. It settles as you continue to use it. Then the second type is applied inside the vagina. It usually comes with an applicator, so you don't need to use your finger. We also have the Passories. They are antifungal tablets that you can insert inside the vagina. This is usually done at night for about 6 days, and it also comes with an applicator. And we also have the main medicine you can swallow, which is called fluconazole. This medication usually comes as a single dose. You just take everything once. However, it's not every woman that should take it. If you're pregnant, if you have diabetes, HIV, cancer, or if you're under 16 or above 60, it is not advisable because yeast infections are usually lower at this age due to reduced estrogen. So if you find yourself under this category, always make sure you consult your doctor before taking any medication. With this treatment, symptoms will usually improve within 1 to 2 weeks. But if your symptoms don't go away after 2 weeks, make sure you consult your doctor, because it could be as a result of other health conditions and not just vaginal yeast infection. Also, if you're having more than 4 episodes of vaginal yeast infection in a year, please go and see your doctor for further evaluation. So how can you prevent yeast infection from coming back or prevent it from even happening at all? The first thing I'll say is avoid using fragrance or scented soap to wash the vagina or vulva. You have to stop using feminine or vaginal wipes. Avoid using deodorant or antiseptic washes. These things disrupt the natural pH of the vagina. So if you keep using them, you keep getting yeast infection. It will keep coming back. The second one is do not douche. Douching is when you use product in the vagina all in the name of cleaning the vagina. The vagina is self-cleaning. That means it cleans itself by itself. It doesn't need you to wash it at all. All you have to do is wash the vulva area with water. And if you must use soap, use a mild fragrance-free soap on the outside only. And the third one is always wear cotton underwear. Avoid damp or tight clothing for long hours. Unlike nylon underwear, cotton makes your skin breathe and keep moisture away. So always make sure you're wearing cotton underwear. So these are some of the most effective ways to prevent yeast infection. If you tried any other method that worked, please share with us in the comment section. You never know who you might be helping. If you've not seen my video on period blood color and what they say about your health, make sure you watch it. And if you found this video helpful, don't forget to hit on the like and subscribe button, and also share this video to as many ladies you know so they will get to see the video and learn from it. And always remember, your health is your wealth. Little changes makes a big difference. Thank you for watching, and I'll see you in my next video. Bye.